All right, we are back. Good afternoon, Salina. Good afternoon, Prosper. We're doing another video in our series about clear aligner therapy. You've probably heard of something like Invisalign or DIY straighten your teeth at home. We are trying to convince you and make you believers that you need a professional. You need to be walked through the process and not just try to take this on yourself. And we do see ourselves as a team of professionals here to walk alongside our patients to get their teeth straightened, get the smile that they've always desired, and change lives in the process, and hopefully prevent you from having to have other costly dental work, crowns, bridges, implants, that kind of stuff down the road from breaking teeth. So clear aligners are great at aligning your bite, and that's why we call our system the Boss Orthodontic Aligners. It is aligning your bite so you don't have to continue to have things done. And today's video is called How Long Is This Whole Thing Gonna Take? I have a lot of patients that ask or tell me stories of other people who have taken them years, multiple rounds of braces, traditional braces, and they think that's the same thing that's going to happen. So I might do a video in the future about round tripping, or the previous way that ortho was thought about, where you take all the teeth, you push them all out, then you bring them all back. It takes extra time moving, teeth through the bone. We don't want to do that. We want it quick, and we want to meet the demands of our patient, which is get me in and out of this and get me some straight teeth, please. So we're here to help with that. Anyway, how long is this whole thing going to take? Basically, it depends on what you are bringing to me. So let's click on the next slide. Here's a great example, and spoiler alert, there's pictures of teeth in this presentation. So please don't send me messages about don't show pictures of teeth. I can't help it. I'm trying to do this series of videos to educate everybody, so you'll see why, but it's important that you understand the difference between somebody who's going to get, an average amount of time, which we're putting on here is anywhere between 9 to 18 months, depending on the number of aligners and, the amount of time that it takes for you to track properly. I will continue to refer to that tracking because if you have, multiple aligners, 20 aligners, let's say, and you get through to number 5 and you take a vacation, or you lose one of your aligners, you've gotten that far, but you're not going to finish on time. And that is why we encourage virtual check-ins, and we want to stay in touch with you the entire time, is to make sure that your teeth are moving the way that we predicted. And most of the time, everything we plan, there's no reason why you shouldn't finish on time if we're going through all the rules and instructions. And the great part is I'm going to do another video on exactly what those rules are. So if you just follow those instructions, most of the time everybody tracks perfectly, and you only see me a few times. And one of those is to just say, hey, great job, we finished it up. So anyway, let's see here. So the average time is 9 to 18 months. This is a little bit more of an average case here. I can't see this picture from the person smiling. This is just from a top-down view, but you can see those lower teeth are pretty common where people collect a lot of stuff when we're doing their cleanings. I'm sure there are a lot of people watching the video who have been told during their cleanings, routine cleanings, that they're collecting a lot of calculus, or their lower front teeth, or their gums are inflamed. This is a pretty common place where there's just a lot of crowding. So an easy way to fix that is to sort of get these teeth tipped out, and as long as the bite is okay, getting the tongue some more space to be able to quote unquote breathe, no pun intended. But if you get the teeth sort of out of the way, your tongue has a little more room and you can breathe better at night. This is all sort of, so you can see these back teeth. Let me zoom in a little bit here if possible. All right, apologize about that. So we are not able to zoom in on the presentation this time, but the back teeth there, you can also see that those are tipped in towards the tongue a little bit. I'll just use my hands instead of zooming in. The front teeth there, where they're crowded up together, Some of those things are fairly easy to fix, and that is just following the instructions. We should be able to finish that one on time. I did want to give you an example here. Again, spoiler alert, more pictures of teeth. This is a little bit more like the series of pictures that we would take when you come into our office. This doesn't include all of them, but we tend to take pictures like this so that we can see how your top teeth and your bottom teeth are coming together. I did want to show you that top tooth. I'm sure everybody can see. Your friends might refer to it as a snaggle tooth or something, just something that's way up high that we'd have to bring down. That's a good example of something where you couldn't come to our office and say, hey, can you do a magic trick and finish this in 9 months? It's going to be next to impossible for that to happen. So we try to get your trays set up so that you can finish as soon as possible, but there are certain circumstances where you don't want to move your teeth too quickly because you can get recession, you could get bone loss and things like that. So we want to play it safe, and I just encourage all of my patients to think about themselves like they're like 95 years old, and that you're going to appreciate that you took the time to make sure you moved your teeth a little bit slower, and not like your age right now where you're like, give me the smile that I want as fast as possible. We're going to do everything we can, but we have to make sure that you have, adequate amount of bone at the end. You've got gums that also look great. It's great if your teeth are in line, but we also want you to not be losing, your gums with recession and stuff from moving your teeth too quickly. So if you can, I know that was a longer presentation, but if you can, give us a call, 972-885-9670. We would love to have your questions, concerns, anything you can think of about how to get your teeth in the proper alignment as fast as possible, and make sure that we find something that makes you happy and also is doing the best for you. So again, contact at openlatedentistry.com, or if you want to, you can always send us a Facebook message. We'll get back to you as soon as possible. We would love to see you, and again, this is in the presentation as well, but we have free orthodontic consultations. We send out these flyers to everybody in the area, Salina and Prosper, for orthodontic evaluations, and they are at no cost. So that's just because we want to get to meet you, get to know your expectations, let you know a little bit about what we can do for you. Okay, and we are having $1,000 off of the clear aligners. And that is, that's gonna last for a little while, but we are trying to make it possible for people to get this done and not have finances as an obstacle. So anyway, y'all take care, have a great day. It's a beautiful day in Salina and Prosper, so head up here, and also check us out as well. We are right on Preston, next to Keller Williams, and also next to a delicious Taco Bell. So anyways, take care and have a good one.